Taking antiretroviral therapy is one of the best steps to living a long, healthy life with HIV infection. Like every other drugs that we take, antiretroviral therapy might have side effects. Some persons might experience mild discomfort, whereas some other persons might experience serious challenges as side effects. In today's video, I'll be sharing with us some practical ways on how to manage these side effects to enable you stay consistent with your medication and to live a quality lifestyle that you so desire. Don't forget, I am Esther Akawe Ugbe, a physiologist and HIV prevention care and support officer with over 6 years experience working both in the hospital and in the community. Don't forget, on this channel, you can also call me your adherence counselor. So let's dive down to what we have today. So let's talk about how this antiretroviral therapy works. It works by preventing the virus from multiplying and also protecting the immune system. However, as the body adjusts to this powerful drug, you might experience some unwanted effects, which is the side effects that we're talking about. The good news is most of these side effects can be managed, whereas some other ones can just disappear on their own after some time. So what are these various side effects that some patients that commence antiretroviral therapy experience? One is nausea and vomiting. This is the most common side effect that most of them experience, nausea and vomiting. How do you manage this? If you're experiencing this side effect, I will recommend you take your medication alongside food. Don't take the medication on an empty stomach. Just take the medication alongside food unless given directive otherwise from the doctor. And also, another recommendation I will have for some persons that have this side effect is to always eat small but frequent to ease digestion. Yeah, eat in a small quantity, but eat more frequently to ease your digestion. And also consume this ginger tea. Yes, ginger tea is actually a natural remedy to prevent or to reduce nausea. Consume ginger tea, and also I will recommend peppermint. Maybe after taking the drug, try and just put one peppermint in your mouth to help stabilize your system after taking the drug. So another side effect that some persons normally experience is diarrhea. This frequent stooling, frequent watery stooling. I will recommend for some persons that have this side effect, always stay hydrated, because since you're having diarrhea, there's every tendency that you become dehydrated. So stay hydrated, drink enough water. If you have this coconut water, also drink that. If you also have an oral suspension, you can also take that. So just try as much as possible to stay hydrated, and also take probiotics too. Yes, probiotics like yogurt to help restore the gut balance. It will really help for those persons that are having diarrhea as side effect to antiretroviral medication. Another side effect that we're talking about here is fatigue and weakness. Some persons, when they commence this drug, they experience this consistent fatigue and weakness. So for persons that are having this experience, take light exercise. So if you're always experiencing fatigue or weakness whenever you take this antiretroviral medication, try to drink enough water, try to stay hydrated and eat balanced diet, and also develop this little habit of taking little exercises like walking and yoga. It will help a long way. It will help over time. Also, if you're also experiencing skin rash or skin itching whenever you commence this antiretroviral therapy, I would recommend you use skin moisturizers. Instead of using your normal soap, you can get a moisturizer. Use moisturizer on your skin. Also use mild soap like Dove. Disclaimer, I'm not recommending any soap, I'm not recommending any cream, but I know personally I use Dove soap, and it's a very good mild soap which also help you. But if you have other mild soap that you think can help at that time, develop the habit of using them, and also use moisturizer. So always keep your skin moisturized at every time. Also develop the habit of wearing free breathable clothes, like clothes that will not absorb too much heat, but clothes that whenever you wear them, hair can easily enter your body, so that you stay refreshed to avoid so much itching and rashes around your skin. Also, I will also recommend antihistamine to help reduce the itching. There are along the counter drugs, antihistamine, that can help reduce the itching and the rashes, but that is until the doctor prescribes a particular one for you. I'm just telling you that antihistamine can also be of help if the rash or the itching is becoming unbearable. But also speak with your doctor to know which of the antihistamine is favorable for you and is good for you at that particular point because of the drug you are taking. Don't forget, we always tell persons that are on antiretroviral therapy, you don't just see any drug and you take. Before you commence any drug, even though you have any ailment and underlying ailments, before you start consuming drug for that underlying ailment, try to see the doctor and maybe present that drug to him, or he or she will prescribe a particular drug for you that will work in line with the antiretroviral therapy you are taking, so that the other drug you are taking will not stop the effect of the antiretroviral therapy. Another side effect that some persons normally experience is problem with sleeping. Most times when they commence this antiretroviral therapy, they find it difficult to sleep. So for those persons that are having this issue of sleeping, I will recommend you speak with your doctor to see if they can change the timing of the drug. If whenever you take the drug, you find it difficult sleeping, all through the night you'll be awake, whereas everybody in the house will be sleeping, I will recommend you speak with your doctor to see if your drug timing can be changed. And also, I will also recommend that you develop a very good bedtime. Like, develop a very good bedtime. That is not the time for you to start watching movie. That's not the time for you to start being on the screen or something. Develop a very good time. Okay, so having given all these recommendations, at what point do you think you can go and see your doctor when you're having all these side effects? We've listed some few side effects on this video, and we've listed some recommendations that I think we help. Not that I think, that I know we help, that have helped a lot of our patients in the hospital. So if you not put all these recommendations into work and you see that they are not working for you, or you see that it is even making the situation worse, book an appointment with a doctor. Try going to the hospital and speaking with the doctor about the side effects you are having. Like, you're having this consistent vomiting that even when you eat alongside the drug, you are still vomiting, and you put all the recommendations together, you are still vomiting, you are still feeling weak, you are still having this, you are always tired. Even when you change the timing, you still find it difficult to sleep. If you know the side effects are persisting or even getting worse, even with all the recommendations that we've given here today, book an appointment with a doctor and see if they can work around your drug. If the drug is not favorable for your body system, so they will see if there's a way they can change the drug and give you the one that is more favorable for you. Other side effects like jaundice too, don't take it lightly. Try to consult your doctor and see what you have to say about it. Or you're having tingling effect around your hand and your leg, try to see the doctor and see the counsel they have for you. Remember that HIV medication is a lifelong medication. So skipping your drug because of side effect or because of anything, it is not proper. You can also go back our previous video to see the various strategies. I'll give about 6 strategies on how to stay consistent with your antiretroviral medication. Try to see them and see how they can help you stay consistent with your medication. If you want to skip because of side effects, we've already said today that you should book an appointment with a doctor to discuss the side effects. And if for one reason or the other you're always missing your drug, also discuss with your doctor to see how they can be of help to you. HIV treatment has saved a lot of lives. HIV treatment has saved and is still saving lives. So if side effect is an issue you are having with the medication, try to see the doctor and see how it can help you manage it. Antiretroviral therapy saves lives. Finding ways to manage side effects is a very great key to staying healthy with HIV. Antiretroviral therapy saves lives. Taking your antiretroviral therapy, taking your HIV treatment saves lives. And finding ways to manage the side effects, it's a great key to living healthy with the virus. If you find this video helpful, don't forget to give us a thumbs up and also share this video with someone that you think will need this video. And also, most importantly, don't forget to subscribe to our YouTube channel so that we can continue bringing you healthy tips on how to stay healthy. Until our next video, bye bye.